Another surreal year heads into its final days, with South Florida once again dealing with an explosion of COVID. Deja vu as long lines form at testing sites around Miami-Dade and Broward. But it's different this time. The variant, the resources, and increasingly the expectations, even as the infection rate sets new daily records this week. And that is where we begin today with Dr. Robert Goldszer, Chief Medical Officer at Mount Sinai Medical Center on Miami Beach. Dr. Goldszer, good morning to you.
Good morning, Glenna. How are you?
Great, thank you. And we appreciate.
Nice to see you again.
Thank you. Same to you. So let's start with those numbers. The numbers are making headlines this week, no doubt, but numbers are not necessarily the story without the context. So put those numbers into context, if you would, for us.
So the numbers, we continue to learn about COVID, no question, over the last 20 months. The numbers are very, very important as far as numbers of infections go. You know, we're up new records every day. Yesterday, 32,000 tests positive. Used to be 1,700 a month ago. So it's a dramatic increase in tests positive. And for those of us working in hospitals, I think also the people flying now are seeing this, that the infections later lead to problems. They lead to hospitalizations. Sadly, some of those people are going to die. But the number of infections is dramatic and markedly increasing in South Florida and around the country. You read about it all over the country and all over the world.
Yeah, and we've learned now, I mean, a year and a half, 2 years into this, we've learned so much about watching the numbers and trying to interpret them. And to your point, we know now that infections come first, hospitalizations follow, ICU follows that, intensive care unit stays follow that, and then in the most severe cases, people don't survive. But in this case, with this new variant that is, last figure I saw was 3 out of 4 people nationwide have this Omicron variant. The talk is that it is much more contagious, but much less severe. And so are you seeing, despite the rise in hospitalizations, are you seeing that natural trajectory where there is the ICU stays and people who aren't making it as much?
Well, you know, certainly we've learned a lot and gotten a lot better than we were in March and April 2020. So we're not seeing it as much. But there are many more people in the hospitals now throughout South Florida. Sadly, the rise is occurring in ICU admissions and those on ventilators. So it is occurring. But like you say, what we're learning about Omicron, you know, certainly from South Africa, certainly from other places, is it may be less severe to each patient, which is obviously a good thing. You know, clearly we're looking at new therapies, which I think will help even more when we get them, when we have them available to us. But for now, I agree with you. We are seeing that Omicron infection may be a little less severe and a little shorter lived. It's you know, some people are getting it quickly and then clearing it a little more quickly than the first 4 waves that we've been through.
Yeah, and I want to talk about those therapies in just a minute, but what's, to your point, what's interesting to me is the CDC director during the Delta wave, when it was very serious, she said that this was a pandemic of the unvaccinated. That was the Delta wave. Now that we're seeing so many breakthrough infections on people who are not only vaccinated, but boosted as well, is this a pandemic of the unvaccinated, or is this Omicron wave characterized a bit differently to you?
Well, it's a little bit different depending on where we're a little bit different about where you're working. You know, for those not working in a hospital, it's definitely different that less people are going to the hospital and less people are quite ill. In the hospitals, you know, for those admitted with Omicron, like you say, it's about 75–80% of the admissions are with Omicron. It can still be quite severe. So in that smaller group, yes, thank goodness, that are being admitted, it is still quite severe. But overall, big picture, I would agree with you. It seems like Omicron is occurring. We do know, though, to follow up on something you'd mentioned, it is not quite as dramatic in Delta, a epidemic of the unvaccinated. But yes, the unvaccinated are having a bigger toll. It's much worse on a patient if they're unvaccinated than if they're vaccinated.
And I want to talk about testing, because we were out at some of the sites around the counties, Miami-Dade and Broward counties, where some of those sites have testing as well as offer vaccines. When I tell you that those testing lines, I'm sure you know, were in some cases miles and hours long, people waiting for tests, when the vaccine lines in some cases didn't exist. You could just drive up and get a booster or get your vaccine. Does that tell you anything at this point?
Well, it tells me where we are in the United States and where we are in South Florida. It's to me, as a healthcare worker, as a doctor, the nurses are seeing this. It's a sad comment that so many of the people that are coming in the hospital could be prevented if they'd gotten their vaccine. The fact that we're left with here in Florida, I saw recently about 62% are vaccinated, so 38% not vaccinated. That group of patients is still more at risk for hospitalization and deaths. So that's a sad comment. It's true, and you're seeing it. People have tried science and sharing ideas and cajoling people and working with people. The mandates have worked. Those places. Now in healthcare, we have a mandate that has increased the number of people vaccinated. So the mandates have worked, but there is still some very strong holdouts that would rather get tested than go for the vaccine, which is, we're very fortunate in South Florida. We've had a lot of vaccine available to us. The U.S. government's making it free for people. It's easy to get it. We know it's safe. Billions of shots have been given, but yet people are not. There's a small, 30%, 38% in Florida who have not gotten vaccinated, and they're at great risk. They're still at great risk. And, I have sort of, at this point, empathy and pity on those people's families because they're still at great risk for hospitalization and becoming very ill.
There is still a great amount of skepticism about the vaccine in different demographics, and we're seeing particularly in young people as well for various reasons. This week, the FDA gave what they call emergency authorized use approval for first one and now two pill form therapeutics. We checked with the Florida Department of Health this week. It looks like this week they are expecting to get about 3,400 pills of the Pfizer Paxlovid. Another segment on how they come up with these names, but 3,400 pills this week for the state. Put that number into context for us.
Well, the pills, I think, will be a game changer. They'll be really helpful and really good for people to get infected and get it early. With production, we need a lot more. 3,400 pills throughout the state of Florida. You got 32,000 people tested positive yesterday. Not all those people need pills, but some of those people need pills. 3,400 pills, and there's about 3 a day for 5 days. So you're talking maybe 1,000 people, 1,500 people are going to be able to get treatment throughout the state of Florida.
And how are those people chosen? Who does that choosing? It feels like almost a Hunger Games situation.
Yeah, we don't have all the guidance yet from the state. These pills are the Pfizer pill is approved for people over 12. The Merck pill is approved for people over 18. So there'll be, obviously some age. They're supposedly for high-risk people that are at risk for going into the hospital, and people with symptoms. You have to test COVID positive. It can't just be exposed and think you have disease. So you have to test positive. You have to have symptoms, and you have to likely be a high-risk group to go into a hospital. Elderly, people with comorbidities, those people.
Understood. And how do these new therapeutics compare with something like Regeneron, which has been being used since the Delta wave? How compare and contrast that?
Well, Regeneron right now is only approved for in-hospital use, although there are some studies giving it outpatient prior to coming in the hospital. Regeneron is a monoclonal antibody treatment. It's a different type of therapy. These pills are antiviral medicines, like remdesivir is an antiviral medicine that's given intravenous. These pills will be very, very beneficial because they should be given early. They're oral and not intravenous, and they can be given outside the hospital prior to coming in the hospital. So that's a big issue for any city, any town where there's so many hospitalizations and so much impact on the healthcare workers and patients, things like that. So this is a big deal if we can keep people out of the hospital.
You know, those therapeutics are, I want to talk about messaging for a moment, because we were talking about vaccines and these therapeutics, and the messaging, new messaging out from the Florida Department of Health that replaces a campaign that was used up until September, talking about, a lot of people might have seen these, talking about the safety of vaccines, promoting going to get vaccines, talking to medical professionals about it. And now those are gone, and in its place, this is some of the video where you see Florida's new Surgeon General talking about everything but vaccines. That's one shot of a syringe. There's no mention of vaccines. There is a lot of mention of the therapeutics, about keeping healthy, what you can do. And one graphic that you're seeing right now that does mention vaccines with all those other things. I don't want to ask you anything about getting political. That is not my intention, because I know how political this is. But my question to you is, what do you think of this messaging? Is this appropriate? Is this something that you find is good for people to know?
I think it's okay for people to know it, but it's off message. It's off central focus for where we can really move forward and get to a place where we can enjoy with family, enjoy with other people, restaurants, and go to things, because vaccine far and away is shown to be effective in preventing serious infection, shown to be effective in decreasing the amount of infection. So if we really want to cut down on having to quarantine for 5 days or 10 days, or having to wear masks, or having to eat outdoors, if we really want to cut down on those things, people have to get vaccinated. That's really the real way to fix this and get this ahead. And here in South Florida, with, again, 30–40% not vaccinated, we're in for, who knows how long, because once you had COVID once and you aren't vaccinated, you can get it again. You can get COVID again. And the pills may help, but they're not as good as a vaccine.
Important message. Dr. Robert Goldszer, great to have you on with us. Happy New Year to you. We'll see you next year.
And to you, Glenna. Thank you very much for having me on, and anytime, and stay safe. Have a good, healthy New Year.
Trying. Thanks so much.